We are in the MSF treatment center in Kailahun. Today alone, the center has admitted 17 patients. Despite the recent expansion, the center has already reached full capacity. Kailahun is one of the zones hardest hit by the Ebola outbreak in Sierra Leone.
We have patient numbers, but it's not too much confidential information. And here it's really like normally how many admission, how many discharge. This is always like discharge. We have it in the afternoon when we have a lab result. And here we have all the lab sample what we are doing. It's like a lot of them is like you see like 201 to 217 is the new cases from yesterday.
The work is done in shifts. The medical staff follows a well-established protocol. Once they return from the tent with infected persons, they painstakingly follow the rules for removing their protective personal equipment, or PPE. The outfits are used once, then destroyed. The epidemic has taken a heavy toll among doctors and nurses. In this region, even the most basic protective and medical equipment is missing.
Le physique à l'intérieur est difficile, les façons de travailler sont difficiles parce qu'on ne voit pas bien, on n'a pas un bon contact avec les patients, ils ne comprennent pas toujours l'anglais, donc on n'a pas la proximité qu'on aimerait aussi avoir avec les patients. Et je pense que ce qui est dur, c'est ces patients qui sont en train de mourir, chez qui on ne peut vraiment plus rien faire à part essayer de leur adoucir la mort, de leur donner quelque chose contre la douleur et de faire en sorte qu'ils partent dignement.
A major obstacle in the fight against this epidemic is the denial on the part of the affected communities.
The wall of ignorance. But now we are trying to put that behind our backs. There is now both realization, awareness raising, and people are going to accept the fact. Because once you accept that Ebola is there, then that is one curative. But if you don't accept, then the disease might take you unawares.
Each death is signaled to a special team in charge of organizing the disinfection and burial. This also involves a tedious process, and logistical means are missing. The body of this deceased baby, just a few months old, will remain in the family courtyard for many hours before an ambulance arrives.
People are missing cars here even, and unless there is a scale-up in human resources, experience with human resources, we will still be behind the spreading of the epidemic. So there is a need to go fast. Every day is counting. Every day people are getting infected, and every day people are dying also. So this is an emergency, and the scaling up of the operation is very urgent.
There is no treatment for Ebola. Early detection and supportive care, while keeping patients well hydrated, will increase their chances of survival.